this is Neevita Narayana from Sphere Speech and Hearing Clinic. I'm a director over here. Professionally, I'm an audiologist and speech and language therapist. We deal with children with hearing loss. We are based from Noida, Lajpat Nagar, Delhi, Gurgaon and Patna. In one of the previous video, I talked about hearing loss in children, the prevalence of it, how we can detect and how we can diagnose. Today, I'll be talking about treatment of hearing loss. Now that we have detected children and also diagnosed them with hearing loss, what do we do next? How do we go next? Parents are devastated. Hearing loss is a big taboo in our society. They can still handle visual impairment, but they are somehow not able to understand or accept hearing impairment. Unfortunately, because of hearing loss, speech is also affected. If a child is not hearing properly, does not develop to speak properly. So speech and language of a child is dependent on majorly on hearing. A child having a good hearing, good cognition, good development will develop a good speech. So it's very important to treat hearing loss. Because of one impairment, a child will be affected doubly, not only for hearing but also for his speech. So hearing impairment is a grave situation which has to be treated as soon as possible. And this as soon can start from 3 months of his age. We can fit an amplification device or a hearing aid based on his hearing loss, which should be diagnosed properly as young as 3 months of age. One should not think that a hearing aid can be fitted when he grows older. Why? Because brain is developing. When he grows older, his brain will develop without hearing. And if his brains develop without hearing, communication is a need. Communication starts at the time of birth. Mother is communicating to baby and a baby is communicating back. When the baby is infant stage, they communicate differently. They communicate through touch and other gestures. But as very soon when the baby is developing, they develop verbal speech. The babies with hearing loss can never develop verbal speech. So it is important that while their brain is developing, their neural network in the brain is developing, they get the input. And they should not be deprived of one major sensory input, that is hearing. So it is mandatory to fit a hearing aid or amplification device if a baby is picked up or diagnosed with hearing loss as young as 3 months of age. And then just fitting a hearing aid is not enough. We have to monitor how the child's speech and language is developing with the amplification device. Is it adequate? Is the baby's speech and language is developing normal, as good as normal children with hearing, with the normal hearing, with the amplification device? Yes, fantastic. So it will never develop just by fitting the hearing aid or amplification device. The babies have to come to speech therapist or the language therapist to guide parents and family members how to interact with children born with hearing loss. They do not develop speech and language naturally. When they are hearing through an amplification device, the sound is not natural as you and I hear. They hear differently. So their speech has to be trained. Their language has to be given. Family has to be oriented how to give the language. Now that training, everyone cannot do it. It doesn't appear as simple as I'm speaking. Believe me, it's a complicated process. But once you get involved, it becomes easy and seamless. Speech and language therapist's job is to guide parents and take them through the process of developing speech and language of children with hearing loss. So once they are fitted with a hearing aid, they have to be coming for regular intervention and that is speech and language therapy, wherein their child is monitored with normal hearing peers, and we see over a period of 3 months, 6 months, 8 months, 9 months, 12 months whether the babies are developing normal speech and language. We just discussed about the treatment of hearing loss in babies and how soon we can fit the hearing aid or amplification device, and enrollment of these babies in an early intervention program or speech and language program. If you know any babies, if you think anyone around you has some hearing loss in children, you're most welcome to contact me through lazoi.com. I'm Neevita Narayana from Sphere Speech and Hearing Clinic based at Lajpat Nagar, New Delhi, Noida, Gurgaon and Patna. You can take an appointment from lazoi.com. Thank you.